I do see COVID-19 as a catalyst for collaboration between health, social, and economic sectors. And I have observed that at the federal level, but also from local level and provincial levels. So as an example, of course, at the federal level, which is where I do a lot of the work, is that different departments have, as I said, put together some of those policies that are so vital. I believe yesterday there was more announcements on supporting housing. Housing, in public health terms, is an absolutely really important determinant of health. If you put a roof over someone's heads, they're likely to thrive much better and address some of the underlying health conditions compared to those who do not have a roof over their heads. I have seen, of course, as I've just said, some of the supports for low-income earners who have precarious work. So those who are in precarious work conditions will do less well under any health crisis. So I have seen some of that as well. Support for violence against women, support for shelters, support for food security, support for childcare and education. So these are really important developments, as well as governance tables that engender this intersectoral collaboration. What I'm really, really keen to see is that this continues, because a crisis helps us sort of understand and make it really real what's happening. We understand that as the individuals, often racialized, as I say, often women working in precarious work conditions, who may be single parents, are trying to essentially look after our elderly and our most vulnerable populations. So the question really in this report is calling for this to be a more sustained approach. So why can't we have those governance structures beyond the crisis and into recovery? And why can't we have these intersectoral collaborations, which much of it happens at the local level, continue, and that different governments support that kind of collaboration? So that's what I would champion and will continue to support.